All right, everybody, welcome to the relief of your back pain. Yes, that's what this video is about. This is a short 20-minute video to help you relieve your back pain. If it flared up, if you tweaked it a little bit, maybe it feels like something slipped. This is my go-to anytime my back flares up. And it really doesn't take that long amount of time. It just takes a lot of intentional movement, a lot of intentional release, and it takes just one tool, actually two tools, a ball and your body. Now, I have a bigger ball here. This is about a softball sized ball. You can also use a lacrosse ball, which is a smaller ball for the things that I'm gonna offer, baseball, things of this sort as well. The bigger ball does come in handy for a couple of the locations that we're gonna do, which you'll see. Now, this video is not just a self-myofascial release video. It is also an active stretching video. We're also gonna do active poses that create a lot of relief in the back. And I'll explain those further when we get there. But first, we're gonna start with this tool, so let's get into it. I always roll my glutes first when my back feels inflamed. Okay, now that can come in two different ways. And I'm actually gonna do this real time with you. I have a timer, so you can just follow along. I'm gonna set the timer now, and I'll explain as we go. So I'm gonna put the ball right under one glute. And then I'm gonna put that same side ankle on my opposite knee. So what this does is expose the piriformis, which is where the sciatic nerve runs through. The piriformis is a muscle that comes through the middle of the glutes. Sciatic is encapsulated by the piriformis within that muscle. If you experience sciatica, which is where the pain travels down the leg, or you feel some radiating discomfort going up your back or throughout your glute, this is probably the one that's going to give you the most relief as far as releasing that nerve pain. Now, when you're here, for the first minute or so, you're just relaxing, okay? You're just really trying to breathe in deeply, especially focusing on the exhale. When we elongate our exhales, we stimulate the parasympathetic nervous system, which is gonna allow the body to relax further into these poses. So I'm deep breathing in deeply into my stomach, and I exhale and relax. That's really the only thing I'm focusing on, aside from just consciously relaxing and keeping the ball in the most tender area. So sometimes it will relieve and the pain will go away. Sometimes it'll get worse. All of these things are normal. Sometimes it can get a little bit more painful. Sometimes the pain can go away. And that's a great sign that your body is physiologically reacting to what the ball is trying to do, which is essentially relieve the muscle tension there that is creating stiffness and tightness in your back and your pelvis. And I can explain further why the glutes are important in relieving back pain. I didn't even do that yet, right? So the glutes stabilize your pelvis, which is the big bony structure in your hips, right? The pelvis is this huge bony structure in our trunk and our midsection. I'm gonna switch sides now because I've done 2 minutes. And if the glutes are tight, not working properly, misfiring, then the pelvis will be misaligned. And when the pelvis is misaligned, that will create an impingement in the low back. It could also create an impingement in your actual hip capsule as well. So there's a lot of things that could come from the pelvis being misaligned. The glutes are just one of those muscles, along with many, many others, that actually cause that misalignment in the pelvis. So this is always my go-to. It's the first one I always go to because it gives me the most relief. Now, your body is different than my body. So this one might help me more than it does help you, but it doesn't mean that it's not important in some way. I recently came across a research article that said that if you sit on your butt, your glutes will turn off within 8 minutes. That means your glutes will stop working and not function properly if you're sitting on your butt. And we all know we are sitting far more than we would like. So if you're sitting, you gotta roll the glutes, you gotta stretch the glutes. Now, in my particular method in addressing pain, the way I like to approach it is I like to roll an area, stretch an area actively, and then engage that same area. And in this essentially way of approaching pain or way of approaching functionality in the muscle tissue, it's the full picture, it's the full spectrum of what's going to create a healthy complex in the muscle that we're working on. So the problem with, let's say, yoga or yin yoga, let's say, where you're super passive and you're holding a stretch the whole time, there's no conscious engagement there. And when there's no conscious engagement, meaning you're not using your glutes or you're not using a muscle that you're desiring to use, then it's just stretching without any neurological engagement. We want things to be able to contract. We want things to be able to work properly as well. That's the whole basis of functionality and things moving and engaging the way they're supposed to. So I will actively stretch my glutes after rolling my glutes for 2 minutes each side. And I think I'm just about there. Yep. So I got 2 minutes of a roll or myofascial release on each side. Now I'm going to go into 2 minutes of an active stretch on each side. I did my left leg first, so I'm gonna do that left leg first here. And I'm gonna get into 90-90 position. So 90-90, I'm at 90 degrees in my hip. That's my knee. I'm at 90 degrees in my hip, my front knee, and 90 degrees in my back knee, okay? And then I'm gonna place my hands on either side of my thigh, that's forward, and I'm gonna very slowly bring my chest up, keep my spine flat, meaning I'm not rounding my spine. I'm gonna keep my spine tall and flat as I bend forward and then come back. I'm going to bend forward and come back. So I could really easily do this, but this is passive, and we're not looking for passive here. When your back is inflamed, it does not want passive stretching. It wants active stretching, creating a nice stable spine, a nice stable pelvis to relieve that pain. So again, I'm gonna continue to do this for the next 2 minutes. I've begun about 20 seconds or so. One little nuance to this as well, along with keeping my spine straight, when I come back up, I'm actually gonna push my knee down into the ground. So I'm actively pushing my knee down to propel my chest back up. So it's almost like a spring is pushing me back up to this vertical position. I will exhale down, push back up, inhale up. Push back up, inhale up. Push back up, inhale up. And I'm gonna continue on here. This is where the body starts to get a little bit warmer because we're actually moving now. We're engaging the glutes while we're stretching it. Hopefully everything else is staying stable. My toes are up towards my shins. I'm not holding here for very long, just a half second, pushing myself back up. Now we're resetting that glute. We're re-engaging it, so we might stabilize the pelvis on that left side. And I'm gonna switch. Hopefully you're still following along with me. Go right leg forward first. It's always really important to pay attention when you're doing this as well, is what does each side feel like? If one side feels more painful on the ball, then you know that let's say that side that is more painful is a side that might need a little bit more TLC. My left glute, for example, is much more painful. So again, I'm in the 90-90, all my angles are proper. I'm gonna lean forward, keeping my back flat. I'm gonna push my knee down into the ground to bring my chest back up. Push the knee down, pull the chest up. Push the knee down as I pull the chest up. Exhale down, inhale up. The breath is really helpful. We'll get into that in a little bit. I've just slightly begun to invite you into focusing on the breath. The breath is hugely important in spine health. So when I offer a breathing technique as we go along, do know that that is very important. And I'll explain that a little bit further shortly. Got about 30 more seconds. Now my right glute is coming online. All right, there we go. So we got both glutes released and activated now. We roll them, we stretch them, we activate them. That rolling came on its own. The stretching and activating came together. RSA, as I like to call it, roll, stretch, activate. Now we're gonna get into another area. Now, when I had really debilitating back pain, I did this particular exercise every single night. There was not a night that I missed doing this because it really allowed my spine to relax. It allowed me to get into bed feeling calm and peaceful and with much less pain that I could actually fall asleep. Now, of course, I would wake up and be in a lot of pain after that, but this was really helpful for me. So it is a very sensitive rolling technique, so be very careful as you're doing this. My instructions are very precise. So the ball here is gonna go, essentially the location that it's gonna go is the psoas or iliopsoas complex, which is in the gut. And I'll explain that a little bit further, and I'll show you what the position looks like. But if your belly button is here and your pelvis is here, you can see that I was actually doing this earlier after my workout. There's some marks there. The front of my pelvis is here, the iliac crest. The ball is gonna go right in between these 2 points, right in the middle. Right there, I will lay on my stomach with the ball there and do this very gently, very slow, right in between those 2 points. I'm gonna kind of creep my body weight down. I'm laying completely flat on my stomach. Now, you can see that my legs are situated differently. The ball is on my left side, so I will bring my right leg forward, and this will create a little bit of an oblique approach to the psoas on my left side. Then my left arm is reached out in front of me. So my left arm, my left leg are straight, my right arm is here for my head support, my right leg is creeped up into a kickstand position to kind of support my oblique position. Now, when you're here, the most important thing is the breath. So what you're about to see is how I breathe in really deeply. You'll see my stomach and back expand. And then I will exhale completely so that the ball and my diaphragm actually relax and the ball will get deeper and deeper into the psoas. And that's extremely important. You have to breathe deeply every time, even though it feels really difficult and challenging. So I'm going to begin now and do about a minute longer. If you have the time to do this for about 2 to 3 minutes on your own. You can pause the video. I'm going to do it for about another minute. The really interesting thing about this one as well, as you're in the gut there, is you're not just releasing the iliopsoas complex, but a lot of the oblique and rectus abdominis fascia, a lot of core engaging muscles that get stuck and get tight. Also the hip flexing muscles from sitting a lot, this area gets really tight and gritty. So when you're in here and you take the breath, you're really releasing a huge complex of things that all tend to get very tight and essentially improperly placed because of sitting all the time. And I know there's really not too much that you can do about sitting all the time, so doing something like this to balance yourself out can be really helpful. Okay, that was about a minute and a half since I said a minute. Now I'm going to switch sides very carefully. I'm going to roll off. And then I will place it on the other side. Again, you're going in between the belly button and the front of the iliac crest. I'm now on my right side, so I'll be reaching my right hand up. My left leg will creep forward as a kickstand. My head is resting on my left arm. And this side is a bit more tender for me. So it really takes some conscious relaxing by deep inhales and deep exhales. I should definitely say that if you've just eaten food or if you have to pee, this is not going to feel super fun, so I apologize. Pause the video and go handle your business if you have to. try to find your relaxation with this. Big inhale. Big exhale. I'm going to do about 30 more seconds. If you are doing this on your own, never do more than 3 minutes, okay? Stick to 3 minutes as your cap. If you want to do longer than I'm doing, you can do that. Just don't do longer than 3 minutes. So we're wrapping up the rolling of the iliopsoas complex now, which means we must now stretch it, okay? So we're going to stretch that iliopsoas complex. Now, we're gonna come up slow, and when you finish doing that, do come up slow. Kind of ease your way up into an upright position, no need to rush. Now what we're gonna do, as I mentioned, is the stretching of the iliopsoas complex. Okay, so you might have seen positions like this before. I'm just gonna offer a little bit of a different perspective on it. So we're gonna be in a kneeling position. Okay. So when we're in this kneeling position, the most important thing here is the orientation of my spine, okay? So especially in yoga, what will happen is that people will get into low lunge like this, and they'll really arch their back. So you can see that my back is super arched here. That is precisely the wrong thing you want to do when your back is inflamed. Okay, so do not hyperextend your back like this. So I'm going to start with my knee directly under my hip. This angle is just perfectly straight now. I'm going to squeeze my right glute, okay, before I do anything. So I'm locking this glute in. As I do that, I already begin to feel how my rectus femoris, my thigh, my hip flexor are going to stretch a little bit, okay? Now that's all I need to do. I might shift forward a little bit, but what you're going to notice is as I shift forward, I don't flare my rib cage and arch my back as I spoke about earlier. I'm going to keep my rib cage down here and even keep a little bit of a rounded spine as I shift forward. And then that's as far as I can go. Now I start to feel how the psoas, which is going to be a little bit more medial in the front of the hip, starts to stretch. Then we add the arm. I'm going to inhale up, lean to my left, exhale down. So it's a side bend, but it's not an arching. So I'm not arching like this, I am bending to the side. And I'll do this for about 2 minutes. Probably won't do quite a full 2 minutes as there are a lot more things we'd like to get through the video, but I'll do about another minute. Again, pause the video if you'd like to do longer. Doing 2 minutes for this is most optimal. Hopefully you're noticing that my glute remains engaged, okay? I've not lost the locking of this right glute. That's very important for stabilizing the pelvis and really allowing me to get the full stretch of my right psoas here. If you have trouble balancing, then there is no problem at all with doing something like this with your hands on something like that. That's totally fine. Okay, I'm gonna switch to my left side now. So my left knee is going to be down. This angle is vertical. I'm gonna squeeze my left glute to lock my pelvis. I'm gonna make sure that my rib cage stays down. My hand is not going to come in front of my chest and shoulder. I'm going to inhale as I push up and lean gently to my right. Exhale the hand back down. These videos and exercises always go much longer than I intend. So I mentioned at the beginning of the video we're gonna go 20 minutes. Probably gonna be more like 30. So there's just so much stuff to cover, especially when it comes to back health. This is a small fraction of the things that can be done, but they are the most potent and effective things that can be done, which is why I'm offering them to you. I'll do another 30 seconds with this side. Now, something to pay attention to when you're doing this one is that when you know you're getting the psoas, you can feel the pull up into your obliques here, okay? Because the psoas comes up in the body, up in that vector that comes up along the spine. So it's not just hip flexors here, it's not just thigh, but it does come up further that you will be able to feel as long as you're inhaling properly. Okay, so now we're done with the rolling and the stretching. This is going to be more for resetting the abdominal muscles. Now, this is super important. Now, what controls our spine? It is our muscles. It's the same thing that controls all of our body, right? But the spine especially, we have a lot of core and trunk muscles. I was talking about the glutes earlier that stabilize the pelvis. Okay, there's a lot of different glute muscles and muscles within the pelvis. As far as core goes, we have rectus abdominis, which is what you traditionally think of as abs when you see a six-pack, rectus abdominis. Transverse abdominis is below the belly button, wraps around the bottom of the spine here. You have internal and external obliques that come in together that kind of control, not kind of, they do control our rotation of the body. You have the psoas and iliopsoas complex that aren't abs, but they are trunk muscles that come up deep within our spine. So what are you gonna do? How are you gonna activate all these things at the same time and stabilize your spine? Well, these are a couple exercises that I'm going to give you right here that are going to kind of encapsulate how your core can function optimally. And if you practice these on their own, your abs will get far nicer, your spine will get far healthier than you doing any amount of sit-ups or planking or anything like that. So I'm going to show you the first one. The first one, you want to make sure that your spine is on a flat surface, and you'll be laying on the ground on that flat surface. And we're gonna place our legs on a bench, couch, table, chair, whatever kind of apparatus that you would like, so that your hips and your knees are at 90 degrees, okay? So this is what I call a inverted chair position, because it looks like I'm sitting in a chair, right? This would be me sitting in a chair, just not upright, laying on my back. And the reason for this is because in this position, this is the least stressful position that your spine can ever be in, okay? So if your back is inflamed and you don't have any rolling techniques and you don't feel like stretching, you can't do anything else because your spine hurts so bad, this is where you go and you do exactly what I'm about to teach you, okay? So we are here. I'm consciously trying to relax everything. So I don't want my hips to be working. I don't want my abs or arms to be working. I'm just totally relaxed here. The one thing that we will do is we're gonna breathe and we're gonna engage what's called the TVA, transverse abdominis muscle, one of those core muscles I mentioned earlier. Now I'm gonna lift my shirt so that you can see what's going on here. Not because I wanna show you my abs, but I'm going to take a deep breath in, and we've kind of addressed this a little bit earlier. We're gonna go more deeply into the breath now. I'm going to breathe in through my nose. As I inhale through my nose, you'll see my stomach expand. This is a proper diaphragmatic engagement. Very important. The diaphragm also stabilizes the spine. It also controls our breath, okay? So as I breathe in through my nose, my stomach will go up. As I exhale, I'll blow the air out of my mouth with pursed lips, and I will pull my belly button down. That is engaging the TVA, transverse abdominis, okay? So as I inhale, diaphragm, as I exhale, TVA. Inhale, diaphragm, exhale, TVA. I'm gonna do this for just 1 minute, but I'm gonna focus deeply on the breath. You're gonna follow along with me. Inhale through the nose. exhale through the mouth. Optimally, you actually don't want tight pants in this. It's not great that my pants are restricting my inhale here. Closer, please. So another little nuance that I'm going to invite you to consider is how much of your inhale goes into your stomach and how much goes into your chest. You want your inhale to be 2/3 in the belly area, and the last third will go into the chest. Okay, so as I inhale in through the nose, the first 2/3 of my breath will be in my stomach. The last third will come up into my chest. And then I blow out through my mouth. Everything lets go, everything goes out. I'm just gonna do 2 more. Okay, so we have now engaged the TVA. The TVA works like a corset around the spine, so it really helps to stabilize the spine. Now we're gonna do the rectus abdominis with the breath, okay? So what you're gonna see is I'm gonna do a big inhale. We're kind of putting the puzzle pieces together here. I'm gonna inhale like I did just now before, and then as I exhale, you'll see that I'm actually gonna pull my pubic bone towards my sternum. So pubic bone, sternum, inhale deeply, exhale, contract, completely relax. We'll do about 10 of these. Now it might look like I'm actually pushing my hips up here because you see my butt coming off the ground, but it's actually all core contraction that's doing that. So do not push your hips up, do not use your legs yet. We will get there. It's just core. Do 3 more. This can take a lot of coordination and a lot of practice, so don't get frustrated if you feel like you can't coordinate these things. It's going to take a little time. Okay, that's number 2 of the core engaging resets. The last one, number 3, is gonna put those first 2 together, plus activating the glutes and the hamstrings, which is gonna stabilize the backside of our pelvis. It's the last piece. So I'm gonna do everything that I just did. I'm gonna breathe in deeply into my stomach. I'm going to exhale, begin the pelvic tilt and the core contraction. And the last piece is going to begin by pushing through my heels to feel my glutes contract and just barely push my hips up off the ground. I'm really only coming off the ground with my butt about 3 or 4 inches. I'm not going way up here, okay? When most people do bridges, most people can go way up here, right? But what's happening is that they're overextending their spine, they're arching their back here, and you can end up feeling a lot of tension in your low back as you do this. We're trying to avoid all tension in our low back because our low back is inflamed, right? So we're gonna go to a point where our glutes and hams fire and engage, but we're not gonna stress our spine. So let's put all those pieces together. I'm going to inhale deeply, exhale, contract the core. Once I can't go any further, I begin to push through my heels, squeezing my glutes, keeping my abs tight, and then I go down and relax. That was 2, I'm gonna do 8 more. Inhale deeply. Now I understand that these kinds of exercises aren't super sexy, but most rehabilitative exercises are not sexy. But what is sexy is actually having your back feel good. So even though you might feel bored or your mind might wander as you're doing these types of exercises, it's important that you re-motivate yourself and refocus on what the actual goal is, which is relieving your back pain. And that can be a strong motivator if your back is really debilitating you. So just keep focused on that when your mind wanders. I want to be out of back pain. I want to let go of my back pain. I don't need to live with back pain. And this is how you're going to get there. I'm going to do 3 more. Okay, so we have our core engaging resets. We have done the rolling, we have done the stretching. There is just 2 more things that I'd like to invite you to play with today. Now, these exercises are called ELDOAs. ELDOA is a French acronym. In English, the acronym would be LOADS. That stands for Longitudinal Osteoarticular Decoaptation System. So just call it ELDOA because that's what the French osteopath who created them called them. The point, which is really what you care about, is what it does for spine health. So when I hold an ELDOA posture, it elongates all of the fascia that runs throughout the body, and we could talk about fascia another time, but essentially fascia and connective tissue is what helps stabilize your joints. So when I hold an ELDOA, it actually specifies the joint that I want to make healthier, which means I can pick any particular segment of my entire spine and do an ELDOA for that part of the spine. So I'm going to show you 2. I'm going to show you L4, L5. That means the joint where your lumbar vertebra number 4 meets lumbar vertebra number 5. That is the low back right here. We're going to do the posture that creates space in between the joint, and space equals mobility. Space equals relieving nerve impingements. Space means creating fluidity and essentially health in that area. We're going to do L4, L5, and then we're going to do L5, S1. L5, S1 is the SI joint, so maybe you've heard of that. A lot of people experience pain in the SI joint. First and foremost though, L4, L5, the first one. Now when you're doing these, it is very helpful if you have a mirror beside you so that you can actually see what your spine is doing just by doing a quick little peek. And we're gonna do these postures for 1 minute at a time, once you get into the proper posture. So I'm going to begin to set my lower body first. So when I say set my lower body first, that means I'm putting my legs in the position that they need to be in first. So for L4, L5, I'm going to bring my knees to 90 degrees on each side. And these tight pants aren't super awesome for that particular posture. And my heels are gonna be a fist distance apart from each other, okay? It's kind of a butterfly position. My toes are not in plantar flexion, but in dorsiflexion, and my foot is in dorsiflexion as well. So my foot is pulling up out towards my shins. I'm going to push my knees down towards the ground using my external rotators of the hips. So you can see this is kind of relaxed. Now watch how I engage, pushing down like that. Now I'm gonna pull my chest up. This in itself is very difficult. So just feel how the hips, the core are working. Then I'm gonna push my arms straight out in front. I'm always going to be externally rotating my hands and thumbs, arms. External rotation is turning the fingers out. I'm going to pull, this is very important, I'm going to pull my chin back, aligning my neck. Once all that is set, I'm going to bring my arms up and push my arms as vertical as I can go, keeping the chin back. Watch this little, the head tends to want to come forward. I pull the chin back for a sexy double chin. I'm continuing to push my knees towards the ground. I'm holding this for 1 minute. Hopefully, if you see what my spine is doing, my spine is as straight up towards the ceiling as possible. And I'm breathing. I'm breathing to stay tall. Now, if you feel like your spine is rounding, meaning you're slouching back, just slowly relax to come out of it. And I'll show you what slowly means, but don't drop out of this position. I have 20 more seconds. I assure you this is much harder than it looks if you're not already doing it. 3, 2, 1, and slowly relax. What you actually probably feel during that has nothing to do with your spine, because you're not really feeling the vertebra stretching. What you're feeling is your shoulders working, you're feeling your body getting tired because you have to hold an upright posture, maybe you feel your hips working, but I assure you the more often you do these LDOs, the more health your spine is gonna receive, because it is an ongoing effect that you will notice in different ways than you would typically notice than just doing a kind of typical static stretch. So now we're going to do our very last pose, L5, S1, the SI joint. You will need a mat and a wall, so I'm going to head over towards the mat, over here. I always love watching people try to get into this one because everybody tries a little bit different. So what I do to get my legs up the wall is I get my butt really close, my side really close, and then I swing my legs up to twist my legs up towards the wall. Okay, so once I'm here, what I'm looking to do is get my legs as straight as possible, but my tailbone has to stay on my ground, or on my ground. The tailbone has to stay on the ground. So if I'm like really close to the wall and my butt comes up like this, because your hamstrings are tight or something like that, then that's not good. We want to keep our butt down. So my butt is on the ground. That's very important. And the rest of my spine is on the ground. Okay, so I'm nice and flat. My heels are going to be about 12 to 16 inches apart. Really what I'm looking for is hip distance, so depending on the width of your hips. I'm straightening my legs as much as I can. I'm pulling the toes back down towards my face, and I'm turning my toes inwards towards each other, which is internally rotating my legs, okay? Now my legs are set, locked out straight. I feel this intense stretching. Now I'm gonna push my palms up towards the ceiling. I'm gonna tuck my chin so that my neck is nice and long. And then once I'm ready with my spine, ready with my legs, my arms will go overhead. I'm pushing my palms towards the wall behind me, pulling my fingers towards my forearms, breathing deeply into my stomach. keeping the legs straight and engaged, continuing to pull those toes back towards your face, turning the toes inward. For 1 minute. Now I didn't look at the clock, I can't see the clock, nor do I have a timer on it, so I'm just gonna do what feels like a minute to me. You should certainly set a timer if you're gonna do this, or just continue along with how long I'm going. I always remind myself of these checkpoints when I'm in this position on my own. The straightening of the legs, the toes, feet turned in, the arms pushing overhead, the chin stays tucked, the breath, all of these things. I'm gonna do about 10 more seconds. And when I'm done, I will bring my arms up, relax my arms, slowly relaxing the legs, roll out to the side, and easily and slowly creep my way towards thriving. All right, you guys, so thank you. Thank you very much for joining me today. I hope this helped in relieving some of your back pain. And if this 40 minutes that was supposed to be 20 minutes was too long for you, you could put pieces together. You don't need to do all this simultaneously. You could do one piece, then another. Pick the pieces that served you the most, that gave you the most relief. And I wish you the best. I hope that your back pain relieves. I hope it goes away. Continue working towards it, and I will see you another day.